All right, I guess we can go ahead and get started, just so we don't get behind schedule. Thank you everybody for joining our call. I just wanted to give a quick welcome and then set the stage for our webinar today. Again, this is a webinar for the PIMS data collection period, which begins August 1st and goes through August 30th. You'll be hearing from our contractors about the Salesforce platform, and all of the important information that's new this upcoming year. So with that said, I'll hand it over to Catherine. Thank you.
Thank you. Thank you, Diana. Hi, everyone, and welcome to the HRSA Data Collection Platform webinar for the Delta States Rural Development Network, DSDN Grantees. My name is Catherine, and I'll be your facilitator today. I also have some other members of our project team on the call as well to help with any questions you guys may have. So today we'll walk you through the new system, the HRSA Data Collection Platform. For some of you, completing the performance report may be brand new, but for others of you who have had grants with HRSA previously, this new system is going to be replacing the old EHB's PIMS, where you previously completed your performance reports. We will be walking through screenshots of the system and then providing a live demo. So please note as we do go through that we have some test information that may look a little bit different than what you will see when you log in. When you log into your account, you will only see program and grant that you are associated with. At the end of this call, we'll answer any of your questions. So throughout the presentation, please feel free to add any questions into the chat box, and we'll do our best to get through all of them. So first, let's go over our agenda for this call. We're going to start off with a quick overview of the change and who will be affected. Then we'll look at how to access the new HRSA data collection platform and how to navigate the homepage. Next, and probably most important to everyone on the call, we'll see how to complete and submit your performance report. Then we'll discuss how to view the approval history and your approved reports. After that, we will look at how to respond to change requests from HRSA. And finally, we will look at how to access your grantee raw data report. So let's start with an overview of the transition. Before we get into system details, let's look at a little bit of background information on this transition. So as of August 1st of this year, any performance reports created for DSDN program grantees will be created and submitted in the new HRSA data collection platform. This new system has an updated look and feel, and it's easier to navigate, so that it should give you a better experience while completing and submitting your performance reports than our previous system. As a reminder, this only applies to performance reports created on or after August 1st, 2024. So that would be for the reporting period of August 1st, 2023 to July 31st, 2024, which means that your submission open date would be August 1st, 2024, and your report due date would be August 31st, 2024. Now let's look at how to access the system and navigate through the homepage. So starting August 1st, you will use this link up here to access the new HRSA data collection platform. When your performance report is set up, you'll receive an email with a link to the system. While this is not this part of the HRSA EHBs, the two systems are connected and they can communicate. So you will still use your EHB's login.gov email and password to complete two-factor authentication to access the system. If you don't have a login.gov account for the EHBs yet, now would be a great time to go ahead and create that. There are some HRSA wiki help pages to walk you through the process that are going to be linked in these slides. And following our conversation today, we will be providing these slides as well as a recording of the webinar to you guys, so you can use that to help you walk through the system your first time accessing it. So on the home page, you will find your username on the top right side of the page. Once you click on your username, you'll find the option to log out of your account. At the top of the toolbar, your first icon will be the home bar. If you ever need to go back home to this main page, then you'll see CBD performance reports. If you click CBD performance reports, you can access your reports from either here at the top toolbar or at the widget at the bottom of the page. Next, you can select the data extracts, which will give you access to your grantee raw data report. That is your next link in the toolbar and your next widget at the bottom of the page. And then finally, in the toolbar, you have an access for help to view our help pages on the platform. So that's also in the toolbar and down here in the widgets. And then in the middle of the page is some background information on the purpose of the performance report. So now that you know how to access and navigate the system, let's look at how to complete and submit your performance report. After selecting CBD performance report from the top navigation bar or the widget at the bottom of the home page, you will see the performance report assigned to you. This list view will display your tracking ID, the submission status, the submission name, grant number, program number, reporting period, and the status. You can access the report by clicking on the tracking ID here. On the performance reports page, you can select different list views to find reports in different statuses. So the page will automatically default to recently viewed, but if you click this down arrow next to the name of the list view, you can access different list views. You can also change the default view. So it's currently going to be recently viewed, but if you're using this page for the first time, you're not going to have anything in recently viewed. So you can prioritize one of these other views, such as in progress, approved, change requested, or submitted. You would just select those and then click the pin, and that would become your new default. You can also search for reports over here in the search bar on the right-hand side by entering either the tracking ID or the status. If you select approved reports from the list view, it will display reports that the HRSA project officer has approved and are in approved status. If you select change requested reports, it will list reports that your HRSA PO has returned for updates. They are in change requested status and they must be updated and resubmitted. Next in line is the in progress reports list view, which displays reports that have not been started or are in progress and have not been submitted. So this covers the not started and in progress statuses. Recently viewed list view, our default right now, shows any reports that you have accessed recently. And then finally at the bottom, submitted reports list view will display reports that have been submitted to HRSA for review, but have not been approved or change requested yet. After opening the performance report, you can view at the top of the page some details about your grant and performance report. This includes the tracking ID as well as the submission date if applicable and your review status. So since no part of this form has been started, the review status is not started and the submission date is blank. In the grantee data entry section, which is the next section down, you can see the status for each of your forms. Not started will be indicated by a red circle outline, in progress will be indicated by an orange clock face, and complete will be indicated by a green check mark. The status of the report is different from the status of the individual forms. So all of these forms could be marked as complete, but if this report has not been submitted yet, then it would only say in progress in the review status. You can select the view button next to each report to see a read-only view of the form, or you can select start in this case if the form is not yet started, or there's also going to be an edit option if the form is already in progress. so you can start working on your report. Towards the bottom of this section, in the bottom right hand corner, is a Generate PDF button, which allows you to view a PDF version of the entire report. And at the top of the page, there will be a click for approval button once all forms have been completed and the report itself is available to be submitted for review and approval. Once submitted, you can track your approval history at the bottom of the page in the approval history section. And it's really important to remember that before you submit your performance report, you must complete all forms. And once your performance report has been submitted, unless it is, if revisions are requested by your PO, you will not be able to edit any of these forms once they've been submitted. So you want to make sure that you double and triple check each form prior to submitting them for approval. So after clicking the Start or the Edit button to work on a form, the first page that you're going to come to is the public burden statement. We'll want you to read through this statement and then click Next to continue to the data entry fields. On the right-hand side, you can see the steps section. So throughout the form, it's going to track your progress on this under these steps section. As you complete each step, they will turn from this blue circle up here into a green check as to indicate that that section has been complete. So we'll go ahead and we'll click Next, and it'll take us to the first entry fields that we have. So as you work through the form, you need to complete each required section of the form. So all required fields will be indicated by an asterisk next to that field. You can compare data from previous reporting periods if applicable. And if you type in any incorrect information, or a required field is left blank, or a dependent field does not match, then you will receive an error message to correct your data like we see here. So the field itself will be highlighted in red, and then an explanation for the error message will appear at the bottom. So in this example, this field can only be filled with whole numbers, and a partial number was entered. So we would update this number in this field so that it would be a whole number. Some fields may become required based on what you enter in dependent fields. So if you enter data into a value field, the corresponding specify field will become required. At the bottom of the form, you'll see that there's an optional comments and file attachments section. These are both optional fields, so you can make notes and comments to send to your PO or for yourself throughout this process. And these comments and attachments will show up on each step of the form. After you've completed all of the data entry steps in this form, then you will click Next at the bottom of the page to save your data and move on to the next step. And here I just want to tell everybody a really important note. There are no save buttons in this system. There's only next buttons. So you can see here that we have a previous button and we have a next button. Data is only saved once you hit the next button and move on to the next form. So if you want to click previous to go back to a previous form, or you want to go back to the main page by clicking that home button, you want to make sure that you're clicking next to save your data before you move away from this page. Another important thing to note is that the system will time out after 15 minutes of, if you're not using it for 15 minutes or more, it'll kick you out of the system. So always make sure that anytime you are going to navigate away from that page, or you're going to step away from your computer, you want to check an email, you have a meeting, if there's any possibility that you'll go over 10 minutes of not using this specific page, you want to make sure that you've filled it out to the best of your ability and click Next. You can always come back to that page and update information, so you can place placeholder information in there if need be to move past those required fields, but make sure that you're always coming back. That's another reason we emphasize double checking your work prior to submitting for approval, just in case you had a day where you needed to put that temp data in there and then you wanted to move forward, but you forgot to come back. So if we go ahead and we click next here, then we'll see that once all of our required data is entered on the form, the status will update to complete. Once all of our forms are complete, you can see up here in the top right-hand corner that the Submit for Review button has appeared, and you can go ahead and click that Submit for Review button at the top of the page in the right-hand corner to submit your report to your PO. Now you'll see that a Submit for Review pop-up window appears. These also are optional comments, so you can add an optional comment that will go to your HRSA PO. If you enter a comment in there, then you'll later be able to see it in the comments section. And then once you've clicked submitted, then it'll show up on your submitted reports review list. So pretend like we click submit. Now let's take a look at how to check on the approval status of your report. So after submitting your report, you can track the progress through the approval history section at the bottom of that page. As the HRSA PO makes decisions, you can see if it's been approved or if changes have been requested. If you need to view comments down here, there's a comment window at the bottom of that page, the bottom right corner, and you can see that there's a little down arrow. So this comment section provides a little preview window, but if the comment is longer than the preview window, you can click that down arrow and it'll let you see the full comment. Once approved by HRSA, the performance report status will update to approved, and it'll show up on your approved reports list. However, what happens if HRSA requests updates to the report while reviewing? Let's take a look at that. So if HRSA sends back the report for updates, we will receive an email with notification with the comments that your PO added about the requested change. The performance report status will then move to the change requested reports list, and the status will change to change requested. You can click on the tracking ID again to access this report. When you open the performance report in the approval history section, you can see that there are new comments from your HRSA PO that have been added. On the right-hand side of the page, that same little drop-down arrow, you can click that and see the full comment that your PO left. Then you go ahead and access whichever of the forms you needed to update to address their comments. And then once all of the forms have been updated that need to be, you would click that Submit for Review button again. Make sure that you are making, anytime you make those changes, once you're done, you're resubmitting for review, because your HRSA PO does not know otherwise that you've done it and doesn't have access to your report, your updated report. Okay, so our last topic for me to cover before I hand it over for the demo is going to be accessing your grantee raw data report. So to access your grantee raw data report, you're going to click that data extracts link at the top of your navigation bar from your homepage or from the widget at the bottom of the homepage. The page is going to default to recent view, just like the list view for our reports themselves. So you probably won't see anything the first time you go in there under recent, but you can click all reports to access every report that is applicable to your role. Then you can select the grantee raw data report to open the report, or you can click this down arrow at the top right-hand corner across from the report. Click the down arrow and you can select run or extract. If we open the report either from run or by clicking the report name, you'll see the report itself. There's going to be a scroll bar at the bottom of the page because these reports have a lot of columns. So if you need to access any other data in this report other than those first few columns, you can scroll on over to it. And you can also open all of these columns, these rows, by clicking the grantee organization to view the grantee organization details. From the reports page, you can also select extract to download the report. If you click extract, you're going to have two options on how you would like to export the data. So you can either export it in the formatted report or in details only. Formatted report automatically defaults to being an XLSX format, and detailed report, details only gives you a lot more formatting and encoding options. Once you select the export option that you would like and any formatting or encoding that comes with that, you would click export to download the full report itself. Okay, so I'll go ahead and I'll hand it over to Jerry to walk us through the demo of the system.
Thank you, Catherine. Give me just a minute to share my screen. All right. All right, I'm sharing my screen, and again, welcome everyone. The screen that you're seeing is the screen that you will see when you log into the HRSA data collection platform. You can see at the very top, it welcomes you to the HRSA data collection platform. And as Catherine was laying out for you, you have your username here in the upper right corner. When you click on that, you have the option to go to the home page from any other page or to log out. And then on this bar here, you have a tab for the home page. So if you were on a different page, you could go to the home page from there. Then you have the CBD performance reports, data extracts, and help. And for the CBD performance reports, data extracts, and help, you also have widgets at the bottom that'll allow you to go to those same places. I'm going to click on the help button first, just so we can look at what is there before we jump into the reports and submitting your reports. So here on the help page, you're going to be able to find information if you need to contact the HRSA contact center. The number is there. There's also a link you can click on. Then you'll see user guides for each division. And there's the CBD help user guide. And also you're going to see some top articles and frequently asked questions. So this is to give you resources that you can use if you find yourself in a situation where you need help. And going from right to left, next I'm going to click on the data extracts tab. This is where you're going to be able to see reports other than your performance reports. We'll come back to this tab after we look at the performance reports. And next I'm going to go ahead and jump into the performance reports. And so when I click on the performance reports tab, this is where you're going to see your performance reports that you're preparing and submitting to the DSDN program for their review. When we first click on the CBD performance reports tab, the window opens up and shows your recently viewed records. That's the default out of the box system for Salesforce. It'll show you your recently viewed records. You can click on the words recently viewed or the little caret next to it, and that'll open up your list view window. And there you can select other list view choices. You can choose approved reports. Those are going to be reports that you've submitted to the DSDN program and your project officer or someone else at DSDN has reviewed and approved that report. You're going to see your change requested reports. Those are reports that you submitted for review and the project officer or other staff at DSDN asked you to make some changes to the report before they will give approval. Next, we have your in-progress reports. Those are going to be any reports that you're currently working on. They haven't been submitted, they're not at change requested, and they're not approved, so they would be in progress. And the status of in progress and the status of not started both fall under the in progress list view. Your recently viewed is any reports that you've viewed recently, and your submitted reports are going to be the reports that you submitted to DSDN, but your PO or other staff at DSDN has not had a chance to review to give a verdict on whether a change request is needed or if it's going to be approved. So you can choose one of these other list views. I'm going to choose in progress. And now we see all of the reports that you have that are in progress. And I should mention that I am working in a test environment. Everything you see here is for demonstration and training purposes only, and development purposes only. And so you won't see all the information for different programs that I have here. You will only see your reports associated with your grant organization for the programs that your grant organization is associated with. I also want to mention that if you have any questions as I'm going through this, please put your questions in the chat. We have Catherine and other members of the team standing by waiting to answer your questions. So I've chosen my in progress reports list view. So you may want to keep this as your default list view so that whenever you log in and click on the CBD performance reports, you get to see what you have in progress. If you want to change that list view from defaulting to recently viewed, then you'll come and click on the pin next to the list view. We get a little green message there letting us know that in progress was pinned. And now whenever we go to the home page, go to the CBD performance reports and open it up, it automatically opens up into our in progress reports as opposed to our recently viewed reports. And you can do that with any of these list views. So if you wanted to only see the reports that you've submitted, or if you want to only see the things that where a change has been requested, you can change those list views to that. I'm going to go ahead and reset our pin back to recently viewed. And so now whenever we come to the CBD performance reports tab, it's going to show once again our recently viewed list views. So now that we've looked at the list views, let's look at what you see when you're looking at the performance reports on this page. The first column that you see is the tracking ID. This tracking ID is generated by the data collection platform system. It's how we track each one of your individual performance reports. You can click on that tracking ID to open up the report. The next column is your submission status. And there are going to be two submission statuses, either past due or on track. Next is your submission name. The submission name is the fiscal year and the program. So at this top one, it's FY 2022 DSDN, and then your grant number, and then the program name. I'm going to open that up a little bit so we can see the full name of the column. There you have it. There we go. And the program name, in your case, that'll be the DSDN program. The reporting period, which shows the start date and end date for the reporting period associated with that particular performance report, and then the status of the performance report, which could be in progress, not started, approved, change requested, or submitted, any of those statuses. So we've got a couple of DSDN reports here. I'm going to open up the one that is not started first so you can see what a performance report looks like the very first time that you open it up. So the first time that you open up a performance report, you're going to see the very first thing on the upper left is the tracking ID for this performance report. Then we have the expandable header for the performance report. When the header's collapsed, you'll see your grant ID, grant number, you'll see your grantee organization name, and you'll see the reporting period start and end date for this particular performance report. If you expand the header by clicking on the little arrowhead here, then again, you see the grant number, you see the grantee organization name, you see that current reporting period with the start and end date, and you'll see the report due date, the review status, which is currently not started, and the submitted date. The submitted date does not have is blank until you actually submit a report. That will not populate until you submit a report. And we're in testing mode, and that's why you don't see a report due date there for this particular performance report. Next, we come down to the grantee data entry section. And in the grantee data entry section, this is where you're going to see your forms for this particular performance report. And these are the forms for the DSDN program. There are 4 forms, each one labeled. And you can see the status of each form. We have a legend over here that, as Catherine mentioned, the red circle means that the form's not started. The yellow or orange clock face means it's in progress. And the green circle with the check mark means that the form is complete. So all of your forms that we're looking at now, because the report's not started, all the forms are not started. And for each form, you have an option to click the view button, which will let you see the form in read-only mode, or click the start button to start working on this form. Now, once you start working on a form and you've made some changes, the form status will change to in progress, and that start button will change to an edit button. Below the list of forms in the grantee data entry section, next you see there's a generate PDF button. And there's a little message here letting you know that if you want a copy of your report, you can click the generate PDF button. And once the PDF file is generated, you can download, you'll be able to download that PDF on your computer. And there are various moments when you may want to generate a PDF. You may want to generate a PDF at the beginning, so you can look at the report and see what all the measures are, so that you can prepare your answers before you jump into the report and start working on it. Some people may want to wait until they submitted the report so they can document what they've submitted to the DSDN program. But anytime you want to generate a PDF, you can click on the generate PDF button, and we'll come back to that. I'll show you how that works.
We just had breakfast, yeah.
And next is the approval history. Currently, there's no information in the approval history. It's an expandable option also, but there's nothing there to expand to see right now. So, and that is what your performance report looks like when it's not started. So I'm going to go back to our CBD performance reports, and I'm going to choose one of the ones that is in progress. I'm going to choose CBD-00933. I'm going to open that up. And when I open this report up, you can see right away in the grantee data entry section, some of your forms are completed, some of them are in progress. All of your forms have edit buttons, none of them have start buttons. But the first thing that we notice on the upper left corner is a note's been added. And that note is, please complete all the forms in order to be able to submit the report. Then again, we have our tracking ID, and we have our expandable header. And when we expand the header this time, again, we see the grantee number, the grantee, the current reporting period, the report due date. The review status on this one is in progress. And again, the submitted date is not filled in because this report has not yet been submitted. And when we come down to the approval history, still no approval history information because the report has not been submitted. So let's look at the forms that we have in the grantee data entry section. So I'm going to go to Form 1 and click the Edit button. And in your program, whenever you click on Form 1, the very first thing that you see when you open up Form 1 is going to be the public burden statement. The public burden statement includes the OMB tracking ID and the other information involved in this public burden statement. And in addition to the public burden statement, on this page, you see that there's a back to main screen button. Anytime you press that, that's going to bring you back to the main screen here where you can see all of the information that we just went over. I'm going to go ahead and click on the edit button again, bring us back into Form 1. So we've got the back to main screen button. We've got the public burden statement down here. And then we have a next button. The next button is how you will proceed to the next step within this particular form. before we go to that, click on that next button, I want to point out the steps over here on the right. Each one of these is showing you which steps you have to complete before this form is totally complete. And as you're going through the forms, the form that you're currently on will have a blue circle. Any form that you've worked on and moved past will have a green circle with a check mark. I'm going to go ahead and click the next button. And you'll notice over here in our steps, the form that we were just on, the public burden statement, now has that green circle with the check mark. And the form that we're currently on, access to care, direct services, has a blue circle. And at the top of this form, we see the form number and the form label. And some of your forms will have instructions at the form level, some of them will not. But we see the instructions there. Then we see that same expandable header with all the same data that we saw on the main screen. And then we start seeing the subsections. The first subsection is direct services. And in the direct services section, there is instructions for you for the information that you're putting in direct services. And then we have the first measure. You'll notice there's a red asterisk next to the measure for direct services. And then there's two columns. The first column is the baseline reporting period column, which you'll notice is grayed out. This is a column that you're not going to be able to edit the fields in this column. It is there in case that column is populated with data. That information is there for you for your review and comparison. And the next column, your first reporting period column, is where you're going to put in the information for the first reporting period. So for direct services, you'll put in the number for the first reporting period. And I'm going to make a slight change to the number that I have here. I'm going to add a decimal place and trigger our first validation that we're looking at. This validation error message is letting us know that this field only allows whole numbers up to 10 digits. So we can't put in a number that it contains a decimal. We can only put in whole numbers up to 10 digits. And I'm going to go put in a few more digits. And if we exceed the number of whole numbers, we exceed that 10-digit limit, we'll get that same validation error again. So I'll go ahead and take all that out. And then below this first measure, we see the comment section. This comment section is where you can add any comments in addition to the information that you're sharing in the individual measures. If you want to give any explanation, you'll notice that each comment section allows up to 5,000 characters. So you can put a lot of information here in the comment section. And the comment sections are form level comments. So if you put a comment in on form 1 on step 2, then you'll be able to see that comment on every other step within that form. And I'm going to go ahead and put in a comment. And then I'm going to come down to our file attachment section. This section is allow you to attach any supporting documents for the information that you're sharing within this form. And like the comments, the file attachments are at the form level. So if I attach a file on step 2 of the form, you'll be able to see that file on every other step within that form. And I did say that both the comments and the file attachments are form level. That means if you go to a different form, if you go to form 4, you won't see the comments and the attachments that you put in form 1. They are only available within the form that you add them. So I'm going to go ahead and show you how to add a file attachment. You click the Upload Files button and then select the file that you want to attach. Click the Open button. You can attach more than one file if you like. And when the file attachment is done, it'll grid a green circle. And when every file is done, the Done button will light up. And I'm going to do that again and just show you how you can do more than one. So as each form completes, you get the green circle. When all forms are complete, you get the Done button. Now we can see all of our attachments are here. You have actions, the option to download the attachments or the option to delete the attachments. If you decide you don't want a particular attachment on the form, you can delete that attachment. And then we come to the next button and the previous button. Above the previous and next button, you're going to see your OMB information again, that OMB number and the expiration date for the OMB number. And then we have the previous button. The previous button will take you back to the previous step. When you click the previous button, none of your work will be saved. So clicking on the previous button takes you back to the next step. If you come back to this step, then your information may be there, but it has not been saved in the system. The only time your information is saved in the system is when you click the next button. When you click the next button, the system does a validation check to make sure all the information meets all the validation criteria for the program and for each measure. And then it saves that information, and then it takes you to the next step. So I click the next button, and now we're on the next step, which is access to care, the types of services provided through the Delta grant funding. And once again, at the top, we have our form number and the label, and we have form level instructions, our expandable header, our back to main screen button, and then we have our next subsection. This subsection has no instructions, but we see our measures that need to be responded to. Each measure with the red asterisk is a required field. So you'll need to go through and add each one of those measures. If you don't enter information in a measure that is a required field, you'll get an error message, a validation message letting you know that that field is required. Go ahead and put my information back. And so as we scroll through, we see all of the fields that are required, and those have all been answered. And then we have an all other new or expanded services value and an all other new or expanded services specify. These value and specify fields go together. The specify field is a text field. It allows up to 2,000 characters. The value field corresponds with it. So if you tell it, if you want to put in that there's another new or expanded service, you can put in the number for that service, and then for that service, you can put in what the service is. This field does allow up to 2,000 characters, and if you put in something with up to 2,000 characters, you can expand it so you can see all 2,000 characters. And so, as I said, they are tied together. So if you try to click on next, or you click on next and you put in a specify information, but you haven't put in a value, the system will give you a validation error to please enter data if other is specified. So you gave a specify comment, so you have to put in the date, the value here. I'm going to put that in, and it works in the reverse as well. If I take out the information in the specify field and click next, then I get a message to please specify the description that goes with this value. And so there's no red asterisk on either one of these, but I want it to be clear to you that when you see the value and the specify together, they're tied together and both need to be addressed. If you fill in one, you have to fill in both. When we come to our comments section, we can see that our comment that we put in on step 2 is here visible on step 3. And I'm going to go ahead and add another comment for step 3. And we also see when we get to our file attachments that all the files that we attached on step 2 are here visible on step 3. And again, we have our OMB number and expiration date, our previous button. I'm going to click next, and we just saw how clicking the next button does a validation check to make sure everything has been entered properly. And if it has been, take us to the next field, the next step. And the next step is population demographics, ethnicity. And once again, we have our form number and title here. title there. And then we have different form level instructions. And then we have the expandable header and the back to main screen button, and our first section, which is the number of people served by ethnicity. And here each field is required. So you'll put in the number of people who served by ethnicity who are Hispanic, who are non-Hispanic, or unreported or refused to report ethnicity. And you'll see a total at the bottom. There is a validation with a previous screen where we put in the direct services. The totals for the ethnicity and race should be equal to the total that you put in for the direct services. And for direct services, we reported 36. So I'm going to go ahead and change that to 12. And now our total equals 36. So back on step 2, we reported the direct services 36. So all of your information that you put in for demographics needs to add up to 36 or whatever number you put in as direct services. And again, we come to our comments section and we see our comments from step 2 and step 3. And our file attachment section, we see all the files that were previously attached. I'm gonna click on next. And next we're in the number of people served by race. And for each one of the racial categories, you're gonna wanna put in a number representing the number of people for that particular category. And again, your total amount has to equal the amount you put in under direct services. Otherwise, you'll get a validation message. And I'm gonna click next. And next we're at the number of people served by age. And again, you're putting in your first reporting period column, you're putting in the numbers for each age category and click next. And next we come to number of people by health insurance status. And in the first reporting period column, again, you're going to put in the number of people that you served in each one of those categories. The total must equal your direct services total, and then click next. And when you click next on the last step in the page, it closes, the last step in the form, it closes that form and brings you back out to the main screen. And you can see that form is now completed. So I'm going to go ahead and jump into the next form, Form 2, Sustainability, and click the Edit button. And on the right, we see our steps. There are 3 steps in this form. At the top, we see the form number and the title, and we see the form level instructions. We see our expandable header again, back to main screen button, our subsection, and then we see the instructions for this subsection. And then we see the measures in this subsection. And there are 2 columns here. This is for the first reporting period. You see the first reporting period start and end date. And then you have an annual program revenue column and an additional funding column. So for each required field, you're going to need to put information in each column. If you only put information in the first column and not in the second column, then you'll get a validation message when you move forward. And so for each one of these required fields, you're going to give the annual program revenue and the additional funding, and then scroll down. And we have another other value, other specify. If you put a value in here, you'll need to put a specify in here. And since these are tied together, you'll have to put a value in for both columns and then a specification description for both columns. And at the bottom of each column, you get a tally for the amounts that you put in for the columns. And then we come to the comment section. We're in a new form, so the comments that we put in the previous form are not visible here. If we wanted to put in comments for this form, you'd have to start putting in comments. Same with file attachments. If you want to attach a file to this one, you'd have to attach a new file, or the same file if you want to attach the same file, but you'd have to attach it to each form if you want to share it with each form. And then click the next button. and that gives us our validation. We're in a test environment. Please disregard that message that came up. That won't come up for you when you're working in the live version of the data collection platform. And so now we're on step 2, the activities. We have our form level title, our form level instructions, and our subsection. And our subsection instruction is to check all that apply. So you can check, and it's not required, so you can check none, or you can check each one that applies. If you check other, then you need to put information in the other specify field. Click next. And that brings us to our next step, the economic impact. Here it's asking you for the ratio of the impact versus the HRSA program funding. And you can put in your ratio. And this field allows whole numbers up to 2 digits or decimals up to 2 decimal places. So you can put in a whole number up to 2 digits or a number with the decimal up to 2 decimal places. And the next field is a drop-down field. So you'll choose the drop-down option that best suits your program or your grant, answers best for your grant. Oh, excuse me. Sorry, I just got bumped for a second there. Give me just a minute to jump back in. There we go. Come on. There we go. It's going to jump back in as our grantee user. Just give me one moment. So as Catherine mentioned, when you're working in the system, if you go idle for 10 to 15 minutes, the system will bump you out. You won't have to do what I did, which was going backspace. You'll just be able to go ahead and log back into the system. So we're logged back in. I'm going to go back to our CBD performance reports. I'm going to go back to the one that we were working on. Go back to the sustainability form. We already filled in this information, so I'm going to click next. Filled in this page, so I'm going to click next. And we were working on this page. We had just given answers here. So I'm going to click next. And when I click next, you see that now the sustainability form is completed. I'm going to edit this form one more time just to show you. If you go through and you click next on 1 or 2 steps within the form, but not all the steps within the form, and you go back to the main screen, then that form is going to be considered in progress again. In order for a form to be considered complete, you need to go through, even if you make the change on the very first page or step of the form, you still need to go through every step of the form and click next on every step of the form in order for the form to be considered complete. And so next, I'm going to go into Form 3. And in Form 3, we see our steps over to the right. We see our form number with the title. We see the expanded header, back to main screen button. And then we have question, which asks, does your grant program fund health promotion disease management activities? And it's a yes, no question. And it lets you know that if you change your response from yes to no, then your data will be erased. So I have yes here, and I put in information here in the subsection below it. If I change this to no, then my information is changed. So you want to be aware of that. If you put yes and put your information in, and then change no, and then click next, when you come back to that page and you say yes, your information may not be there. It retained it this time, but if you close the entire document or the entire report and come back to it a week later, don't expect that this field will be filled in for you. There's a clear warning here that if you change it from yes to no, the data will be erased. So I'm going to keep this yes for now. And we answered this question. And again, we have our baseline field that is grayed out and not active, and we're reporting everything in the first reporting period field, which has our reporting period start and end date underneath. Then we have the comments and file attachments, and click the next button. And on the next page, we have another yes/no question, and the same applies. If you change from yes to no, your information could be erased. Click next. And same thing with our third step, dental and oral. You give a yes, no, and then for dental and oral, there's a little bit more information required. A little bit more information asked for. You'll see there's no red asterisks next to any of these, so none of these fields are required. But they'd like you to give the information that applies for you, and then click next. And we come to the last step. You'll give your answer and give the answers for each measure as it applies, and then click next. And now this form is complete, and all of our forms are complete. Clinical measures is similar to step 3, or sorry, form 3. You have a yes/no question on the first step, and if you answer yes to the question on the first step, then you'll need to provide the information for all of these fields on the next step, and then click next. And so now all of our forms are complete. And when all of our forms are complete, we're going to notice a couple of differences. One, we get this message here: all forms have been completed and validated. You may proceed to submit this report. And next, we see the submit for review button is now visible. And our status is still in progress for now when we expand the header. And we can see that the approval history is still empty, and I'm going to go ahead and submit this. I'm going to click the submit for review button. And when you click submit for review button, a submit for review window opens, and there's a comments section. This is optional. It allows up to 4,000 characters. And so you can put in a comment. If you change your mind at this point and you decide you want to do a little bit more work on the report before you submit it, you can click the cancel button and go back to the report and continue editing. I'm going to go ahead and submit this report. So I'm going to click the submit button. Okay. We're working in a test environment. Bear with me here. I'm just gonna log out as our grantee, since we had a little issue before. And I'm gonna log in as our grantee again. Oh, I see what happened. I logged in as the PO user because I was ready to start approving it on another screen. So that was my fault. I apologize for the delay, everyone. Got a little ahead of myself. Sometimes multitasking can get you into trouble. All right, so I'm going to log in as our grantee. And go back to our report. That is ready for us to submit. I'm going to click the submit for review button. I'm going to put in my comment. Check my errors first. Then I'm going to click the submit button. And now it's going to work for me. So now our report has been submitted. And
Good.
our report has been submitted. And we can see that we no longer have a submit for review button. If we expand the header, then we can see now our review status is submitted and the submitted date is today's date. And then if I scroll down to the approval history, I can see the approval history has now been populated with the most recent record at the top, the date and timestamp, the status, the person who made the change, and the comments. And these comments are expandable. You can see a truncated version of the comments on clip text. And if there was a longer comment, you could change it to wrap text and you'd be able to see the full comment. So our report has been submitted, and this is a good time for me to show you the generate PDF option. So I'm going to go ahead and click the generate PDF button. Which was working before. Log out and log in again. Sorry, I got bumped out of the system. All right, I'm going to log back in as our grantee. And click the generate PDF button. And now it's generating the PDF. It's bringing up the preview screen. And as the preview screen is loading, you'll notice it says generating PDF here. And when the PDF is ready, you'll see the preview here, and you'll be able to click the download PDF button. And open that PDF or go to the file where your downloads are stored. And then you can view the PDF. The program title is at the top, your organization name, your grant number, reporting period, start date, reporting period, end date, the submitted number, submitted date, the report due date, your public burden statement is the very first thing. And then you begin to see the information for each measure, the measure name, and then the answers that were provided. And at the bottom of each page, you see the reporting period, the date the PDF was generated, and what page you're on. So you can scroll through and see all of your information that you've entered throughout. And you can, this is a PDF like any other PDF, you're gonna have the option to save it or to or to print it out, however you want to handle that PDF, just like any other PDF. Okay, and so now I'm going to, now that our report's been submitted, now I'm going to take a minute and just have our PO approve it, set it to change requested so that you can see what it looks like when you get a change request back. Just give me 1 second.
Hello,
All right, and so
hello.
all right, and so now when our
Are
grantee,
you talking to her?
I may need to log out here and log back in. I'm just going to log out and log back in because I had to log in as the PO so that I could make the change request. Just going to log back in as our grantee.
Thank you, sweetheart. Thank you, Miss Caroline. You're going that stick.
And so as our grantee is logging
You
in,
want to go with us?
so when our
Okay.
grantee logs back in and they click on the CBD performance reports option,
Okay.
they will now see that when they look at this
Alrighty.
report in the status, it has a status of change requested.
So far,
Also, if they change the
pretty
list view
good.
to change requested
being
reports, they'll see that it is listed
That's
amongst their
right.
change requested
Thank you,
reports.
sweetheart.
And you can open up that report by
Bye-bye.
clicking on the tracking ID. And again, you'll see that the option to submit the report for review is there. The grantee will be able to edit these forms to go back and make the change that was requested. And let me expand the header so you can see the review status is now change requested. If the grantee goes in and makes a change to one of the forms, change this to 35. Now, the review status is back to in progress because the grantee has begun working on the form. And if we come down to the approval history, you see the most recent activity at the top, the date and time stamp, the status is change requested, the person who set it to change requested, and the comment. And as I mentioned before, these comments are expandable by clicking on wrap text. You can see the full comment as opposed to the truncated comment in clip text. And you can make your changes and submit it again. And oh, I should have mentioned that these comments that are here for change requested, you will also be able to see those comments in the email notification that you receive that lets you know that the status of your performance report has been changed to change requested. So you'll be able to see those comments there and here in the approval history. And you can go through your performance report and make your changes, submit it again. And if the performance report is approved, then it'll look something like this. This one has a status of approved. The status will be approved. It'll show that submitted date that was when it was last submitted. And in the data entry section, you'll see that you can't make, there's no longer an edit option for any of the forms. They can't be edited because they've been approved. And in the approval history, you'll be able to track all of the steps that led to the approval. And the last thing I want to show you before we go to your questions is the data extracts. I promised you I would get back to this. So in the data extracts, this is where you're going to see reports in addition to your performance report, mainly the grantee raw data report. The first time that you log into data extracts, first time you click on it, it's going to, well, it's always going to show you your recent reports, but the very first time you won't have viewed any reports recently. So this window will be blank. And what you'll want to go to is you'll want to go to all reports and select the report that you want from all reports. So I'm going to select the DSDN grantee raw data report. And this grantee raw data report is a report that lets you see all the information that had been put in for your performance report in one place. So if you have, in this case, the grantee has 4 performance reports, all of those performance reports, all the data is here in this one report. Each grantee only sees the data in the grantee raw data report for their grant organization. You don't see any data for any other grant organization, and no other organization sees your data. And the first thing that you'll notice is you'll see the program name, you'll see the data collection start and end date for each one of the performance reports. You'll see the grant number, the grant organization name, the grantee state, the grantee city, and the tracking ID to let you know which performance report the information is associated with. And then you'll start seeing columns for the measures that are in the performance report itself. So in the same order that you saw the measures in the performance report, you'll see those measures column names here. You'll see those measure names as the column headers here. So as you scroll through for each column name, you'll see what you answered for that particular measure in that particular performance report. So we just worked on line 2, which is 933. So as we're tracking line 2, we're seeing the information that was put in on the performance report that ends in 933. And as you're scrolling through, you will come to comments, your form comments. The form comments in this report indicate that you've reached the end of the form. So when you get to form comments, form 1 comments, the next data that you'll be looking at should be the data for form 2. And when you get to form 2 comments, the next data that you're looking at is for form 3. And these raw data reports can be exported. You can click on the export button here to export the reports, and you have 2 export options. You have the formatted report option, and you have the details only option. The formatted report option is going to show you the report in a similar fashion to what you see on the screen when you're looking at the report. It'll have all the same headers, groupings, and filter settings. The details only report is only going to show you the data, no groupings, no headers, no filters, just the data itself. And in the formatted report, you have one format option, which is the Excel format .xlsx. In the details only format, you have multiple format options, 3 actually, .xls, .xlsx, and .csv. You can also choose different encoding options. When we're talking about the form comments before and how they allow up to 5,000 characters, and we noted that there were some fields that allowed up to 2,000 characters. Those longer comment fields can be truncated when you're looking at the report in the user interface and when you're looking at the report in the formatted report type .xlsx. If you want to see the full comment on any comment that's a long comment, then you're going to want to export as the .xls format. And that way, any long comments that you put in the full comment will be in that spreadsheet and available for you to be able to review. Otherwise, if you don't need that, you can use the formatted report and see the report similar to what it looks like in the UI. So let me show you both options, and then I'm going to really stop and take questions. So we see here our option to open this file, the DSDN grantee raw data report file, or I can go to the window where it's stored. I'm going to go ahead and open it. There it goes. And it opens up. And as I mentioned before, it looks very similar to the report that you see when you're looking in the user interface. I'm going to go ahead and close that. I'm going to go back to our export options. I'm going to export as details only and the .xls format. And you'll notice that this one doesn't have the name like the grantee raw data report. It just has this computer generated number. And when you open that report, there we go. Salesforce just gives you this warning message because the report name doesn't match the DSDN grantee raw data report. So just to make sure that you want to make sure your report is safe, they give you that option. It's not an error message. You can proceed. All you just need to do is click yes, and then the report will open up for you. And there is the report. This is the no frills version of the report. As I said, it doesn't have any of the headers or groupings or anything else. It just shows the data. Each column name is still the header for the measure. They're still in the order that they appear in the user interface. It's just it doesn't have that same look and feel. But all your data is there. And either one of these reports that you export are Excel spreadsheets or CSV format. You can treat them like any other Excel spreadsheet or CSV formatted report that you generate. And that is everything I wanted to show you. I'm going to give it back over to Catherine for closeout and questions.
Thank you, Jerry. Okay, I have a few other important reminders to go over, and then I'll launch into questions. So just really important information for you guys to take away from today. The data does not auto-save in the system. So you want to be sure to check next on every page that you work to save your work on that page. And to go hand in hand with that, the system will time out after 15 minutes of inactivity, and you'll lose any unsaved information that you've entered. So make sure you're always clicking next before navigating away from the page or stepping away from your computer or your web browser to work on something else. Required fields will be indicated by an asterisk next to them. So you won't be able to proceed to the next page without filling those fields in. After you've submitted your performance report, you cannot make edits unless your PO request changes. So make sure that you're double, triple checking your whole entire report before you're submitting it for review to your PO. And then after your HRSA PO request changes, you must resubmit the report for your PO to be able to review it again. So you can't just make the changes and then think that it's all good to go. You've got to click that submit for review button at the top of the page when you're done making changes. So as I mentioned earlier, we have some resources for you, and Jerry showed you some of the resources that we have available. We'll be making this webinar today, the recording of it available, as well as the slides that went along with it. But you can also find step-by-step guides and frequently asked questions on our help tab that Jerry showed you. If you have questions or issues logging into the system, please contact the login.gov customer support team. If you have questions related to your performance report, please reach out to HRSA customer support or your HRSA PO. And if you have questions directly about your grant or the data needed for the performance report, you should also reach out to your HRSA PO for those. So let's go to questions. Are there any questions? I didn't see any in the chat window throughout our call so far, but does anybody want to unmute themselves to ask a question? Please feel free, or put it in the chat and we can read it out for you. No questions? You must have done a phenomenal job, Jerry.
Well, I do have a
They don't have a single
question. Hello,
question.
hello, hello. Can you hear me?
Oh, good. Yes,
Yes, I have
we
a
can hear you,
question.
George.
Yeah, this is George. I have a question. Jerry, for the front part, when you get to like where it says behavioral health services and HIV services and all of that, on the old report, we never put numbers that we just selected if we use those for our grant program. But I seen on the illustration that you had like 35. Is that where we supposed to put the total number of services provided for that particular service? I just want to make sure I'm putting the right thing there.
So
do you know what I'm talking about? It's in the first, right up on the direct services. You got the direct services, and then you have a list of things that you focus on. It could be oral health, behavioral health, mental health. I think it says HIV. But I know normally on the old report, we would just put a 1 there if that was a service we provided, and we put a 0 in there for if we didn't. So I seen on the example that it was like 35, put it in that spot. Do we supposed to put a total number there, or are we just still selecting what we're doing within our grant program?
So for the behavioral health, mental health, and I'm going to go ahead and share my screen.
Okay.
All right. So, George, can you see my screen?
Yes, I can.
All right. So the instruction here says, yeah. It's collecting the aggregate count of the number of people served through the program and the types of services that were provided during the budget period. Please report the response using a numeric figure. The total number is 0, then please put a 0 in the appropriate section. So yes, the number of people that you served.
Okay.
Diana,
Okay.
do I have that incorrect?
No, that's right.
Okay.
Do we have any
Okay.
other questions? Thank you, George, for asking. Anyone else? Okay, I guess we can give you guys back a few minutes of your day. Thank you so much for joining us today.
Thank you, everyone, for your time today.
Thank you.
I hope everyone has a lovely rest of their Thursday and a lovely rest of your week.
Thank you, and you do the same. Yeah, Saeed, we can stop the recording.